Alright, biological aspects of depression. The depressed brain, levels of activity. There's decreased activity in the left frontal lobe, which is active during positive emotions, which makes perfect logical sense. The neurotransmitters, there's levels of norepinephrine that are lower during depression, and they're too high during mania. Serotonin levels are also lower during depression. That's why a lot of drugs that treat depression are those SSRIs, which is the selective serotonin reuptake inhibitors that block the serotonin from being reabsorbed so that there's more available, which seems to help treat depression. There are also psychological and social influences. Negative thoughts and negative moods interact. Self-defeating thoughts can arise from the learned helplessness that we talked about before with the dogs. Women's increased vulnerability to depression may be related to our tendency to overthink. And our outlook, of course, influences whether or not an event will become depressing. For example, when you break up with somebody, if you take it in the way that this is hard, but I'll get through this, that you miss them, but you rely on your support network of friends and family. If you make it an external, don't blame yourself. It always takes two to make a relationship, so this just wasn't going to work because while I may have been willing to work, they obviously weren't. Then you're going to have a much more successful coping than if you go the path of saying that I'll never get over this, that you're nothing, you can't do anything right without this person, you take all the blame onto yourself. That will lead you much more likely to be depressed than the other path. We have a chicken and the egg problem with depression though, because which comes first? The pessimistic explanatory style, so being pessimistic in the way that you explain your life events, or the depressed mood itself. A depressed mood may trigger negative thoughts. It can put people in a bad or sad mood, and they tend to be more pessimistic. And if you think about this, this makes sense. But those negative thoughts can also worsen depression, which makes it a kind of self-fulfilling cycle. So you have the stressful experiences, your negative explanation of them, which leads to your depressed mood, which makes you act differently, that leads to more stressful experiences, which you also interpret negatively. It's this vicious cycle that's really hard to break out of, but what you have to recognize is that any of these four exit points, there is a way out in how you interpret the experience, in how you allow your mood, or whether or not you get treatment for the depression, and how you change your behavior or not. Alright, schizophrenia. Schizophrenia is actually a group of several severe disorders characterized by disorganized and delusional thinking, disturbed perceptions, and inappropriate emotions and actions. It disrupts social relationships and makes holding on to a job difficult. I read an article about a girl with schizophrenia, and she lost a job at one point when she was working for a hotel because her manager got very annoyed that she was checking in non-existent clients. They were not people that were actually there. They were her hallucinations, and she was working by herself at night, and she would hallucinate people coming in and wanting to check in and check them in. And then the manager would come in and see that she had checked in people that weren't actually there. They'd go up to the room and there would be nobody in it, which made them have a lot more work. So she ended up losing her job because of that. There are two kinds of symptoms, positive and negative. Positive symptoms means there are things that are there, like inappropriate behaviors, hallucinations, the disorganized speaking, laughing or raging at inappropriate times. The negative symptoms are things that should be there but aren't, like feelings or actions that you expect to be present or absent. They might speak in a toneless voice, have expressionless faces, they may be mute or not move and be rigid. Disorganized thinking sometimes appears as word salad, which is jumbled ideas that make no sense. These sentences are examples, a little more allegro in the treatment. And liberationary movement with a view to the widening of the horizon will ergo extort some wit in lectures. Neither one of those make any sense. There's a lot of words in there, and each word has meaning, but put together they don't mean anything. Often they are distorted by delusions, which are false beliefs. A common one is persecution, so something being out to get them, or delusions of grandeur, which is where they think there's somebody more important than they are, like the president or Jesus. Hallucinations, of course, is the most commonly thought of feature with schizophrenia. People may hear, see, feel, taste, or smell things that are not there. These most often take the form of sounds, usually voices giving insults or instructions. Inappropriate emotions and actions. Emotions are often split off from reality. They may laugh at their grandmother's death, or cry when others laugh, or become angry for no reason. Others may exhibit a flat affect, and affect has to do with the emotions and feelings you're displaying. So a flat affect would be to be expressionless and emotionless in the way that you're displaying yourself. Instead of looking happy or sad or upset or something, you wouldn't have any reaction. They also may have inappropriate motor behaviors. They may do senseless compulsive acts or remain motionless for hours in catatonia. There's a Robin Williams movie where he's in a mental institution. It may be part of Patch Adams, I can't remember. And there's actually a catatonic patient that sits there with his hand up in the air. If you've seen that movie, you can remember that scene. Onset and development of schizophrenia. About 1% of the population has schizophrenia. That means nearly 1 in 100 people will develop it. And there's 24 million sufferers worldwide. Men tend to be struck earlier, more severely, and slightly more often. It can be a sudden appearance or develop gradually over time. When it's a slow developing process, it's called chronic or process schizophrenia, and recovery is doubtful. This often has more negative characteristics, and it's more common in men. Recovery is actually more likely when a well-adjusted person develops it rapidly, called acute or reactive schizophrenia. These episodes typically follow stress. These are often characterized by more positive symptoms such as hallucinations, and those positive symptoms actually respond much better to drug therapy than the negative symptoms. Understanding schizophrenia, it seems to be brain abnormalities that are tied in with what's going on in these people, and we've studied the brains of schizophrenic patients trying to gain insight into the causes of this disorder as well as treatments. There is a dopamine overactivity. They have too much dopamine and an excess number of dopamine receptors. So drugs that block dopamine receptors often lessen the positive symptoms, and drugs that increase dopamine, amphetamines and cocaine being examples, sometimes intensify these positive symptoms as well. There's also abnormal brain activity and anatomy. There's low activity in those frontal lobes. PET scans during hallucinations saw activation in the thalamus and the amygdala, and areas of the brain shrink and fill with fluid, causing lesions in the brain. So it involves problems with several brain regions and their interconnections. Prenatal environment and risk. Viral infections in the prenatal environment seem to contribute to the development of schizophrenia. There's an increased risk if the fetus develops during a flu epidemic, if they're born right after flu season. Also, mothers who report being sick with the flu during pregnancy are more likely to have schizophrenic children. There seems to be also a genetic basis. The predisposition to the disorder seems to have an inherited factor as well. The odds of being diagnosed overall are 1 in 100, but if a sibling or parent has schizophrenia, that drops to 1 in 10. And you can see here the chart of the difference between fraternal twins and then identical twins. So identical twins have a much more higher chance of being diagnosed if their twin has it than fraternal twins do. Identical twins also share the prenatal environment, however, so it's not just the fact that they have the same genes. So the shared germs plus the shared genes seem to produce identical twin similarities. The chances of sharing a diagnosis are 6 in 10 if the identical twins actually shared the placenta versus 1 in 10 if they had separate placentas, which just depends on when the egg splits. So adoption studies confirm that a genetic link is real, but it doesn't tell the whole story of what's going on. In these brain scans, you can see these enlarged cavities in the brain, these fluid-filled cavities we talked about. If you look at that middle butterfly, the schizophrenic twin has much larger middle space than the non-schizophrenic twin. And other spaces too if you keep looking around. So in the end, these mental disorders and others, from panic disorder to schizophrenia, are the subject of much suffering, much research, and much effort in the form of mental health treatment, which is also known as therapy. And that's what we're going to talk about next week.